Deafness and Dementia, Predicting the Future for Scotland. There is a known association between hearing loss and dementia, and it is thought that untreated hearing loss may be a risk factor for cognitive or intellectual decline. Cognitive decline is when your brain doesn't work as well as it used to. For example, a person who has cognitive decline may have trouble learning, using language, or remembering things and people. In 2017, the Lancet Commission concluded that 35% of dementia could be prevented by modifying 9 risk factors. Low education, midlife hearing loss, obesity and hypertension, late life depression, smoking, physical inactivity, diabetes, and social isolation. Hearing loss is now considered to be a changeable risk factor for dementia. While the link between hearing loss and dementia has been firmly established and an increasing amount of research on the topic has been done, there is a noticeable gap in studies that are specific to the situation in Scotland. In order to plan health and social care management for an increasingly older population, it is essential to have a detailed understanding of the number of people with hearing loss and dementia in Scotland. To ensure that the whole spectrum of deafness is included and to emphasise the diversity needed in terms of the range of services needed for those with hearing loss and dementia, this report will use the 4 pillars of deafness model. This model is at the centre of the work that Deaf Scotland does. This project has been funded by the Life Changes Trust and is in 2 parts. In the first part, a search was made for sources which provide statistics on deafness and dementia. We calculated baseline figures for each of the 32 local authorities in Scotland. Then, using population statistics from the National Records Office, these numbers were projected to give future estimates. Part 2 of the project involved a focus group of audiologists in Scotland. Participants in this group were asked to give opinion on current service provision available for those with hearing loss and dementia. A literature review has shown that current research and future research proposals highlight the importance of understanding the link between hearing loss, social isolation, and how this influences cognitive decline and dementia in older adults. Like hearing loss, social isolation was identified as being a changeable factor for dementia. Making the connection with hearing loss has the potential to positively impact on 2 factors which cause dementia. The current UK-wide COVID-19 lockdown has brought the impact and understanding of social isolation into the mainstream, and the devastating effects this isolation has on people with dementia has been openly discussed in the media. Those with hearing loss are at risk of increased social isolation. Those with hearing loss and dementia are doubly vulnerable, and the limited social interaction during lockdown increases the risk even further. In summary, the aim of this project has been to provide baseline figures for those with hearing loss and dementia in Scotland. It is hoped that these figures, together with an analysis of current service provision, will help inform and plan future service provision.